if we see scenario where a person suddenly develops very high grade fever of 103, 104, along with excruciating headache and body pain or joint pain, and after a couple of days he or she develops rash all over the body, or another person who may get severe fever with chills every alternate day, or somebody who has recently been to some forest area or some treks, and then after 5 to 7 days of returning develops fever, rashes and body pain, then friends, in all these three scenarios we may be dealing with one or the other of vector borne infections. So, hello friends, I am Dr. Piyush Chaudhari. So, today I am bringing to you the next video on the Fever Care Center for Infectious Diseases, wherein we are going to discuss about vector-borne infections which are common during monsoon. There are several vector-borne infections known in humans, but out of that, we shall be discussing the most common ones and the most relevant ones for our scenario. So basically, what are these vector-borne infections? So these are basically infections which can spread from human to human, or in some cases animal to human, only via mediation of an insect vector. Without vector, these infections cannot spread from one person to another. Now these vectors could be of different types, most common being mosquitoes. Some could be related to ticks, mites, fleas, etc. So in Indian context, the commonest vector-borne diseases would include the ones which spread through different types of mosquitoes like dengue, chikungunya, malaria, the recent emerging one Zika virus, then the relatively less common and geographically restricted one Japanese encephalitis, or several other forms of viral hemorrhagic fever or arboviral infections. If we see vectors like mites, ticks, etc., then the most important group of infections caused by these vectors are rickettsial fevers, of which scrub typhus and Indian tick typhus of the spotted fever variety are the most common ones in Indian context. Now to see them in detail, when it comes to dengue and chikungunya, they both are essentially transmitted by the same type of mosquito, that is Aedes mosquito. These mosquitoes, because of various environmental factors like accumulation of clean water at multiple places, frequent road constructions and other construction activities, spells of heavy rains followed by dry spells a week or two later, and relatively drier weather at rest of the times, all these factors favor growth of Aedes mosquitoes and hence spread of dengue and chikungunya. So these infections are fairly common in cities like Pune, Bangalore, Hyderabad, etc. On the contrary, something like an Anopheles mosquito which spreads the infection of malaria, that is found more in cities where there is more crowding, humid weather, there are slow streams of relatively salty sort of water, and there are large areas of waste disposal. So this infection is relatively much more common in cities like Mumbai, Chennai, Mangalore, etc. But it is endemic in many parts of India and many districts in Maharashtra as well. Coming to the symptoms, in dengue and chikungunya, both of which are viral infections because of the dengue and chikungunya viruses, the essential symptom onset is sudden. So like few hours prior, the person may be absolutely fine and suddenly he or she starts getting high grade fever with chills, and typically in first 48 to 72 hours, the pattern of fever is like most other viral infections with very high ranges of 102 to 104 degrees occurring every 4, 6 or 8 hourly. Along with that, both these group of patients have significant amount of joint pain. Now, a differentiating factor for dengue compared to other viral infections or compared to chikungunya also is excruciating headache, mainly on the frontal part, around the eyes and behind the eyes. So whenever somebody who comes with a high grade fever with chills and has severe headache behind the eyes or around the eyes, then that should be the first clue towards the possibility of dengue and necessary test should be done. over the period of course of this infection, as we move towards day 4 5, the fever, body pain, joint pains, headache, they gradually reduce, but around the same time, first the white blood cells and then the platelets are likely to reduce. How much will the WBCs or platelets drop will does vary from person to person, and over next 2 3 days both these cell lines continue to drop, and then after which first the WBCs then the platelets increase. So in a typical natural course of dengue without any major complications, the overall duration goes from the beginning of symptom onset till the recovery of blood counts of around 8 to 10 days, at times 12 to 14 days maximum. Similarly, in chikungunya, right in the beginning, there would be high grade fever with chills and joint pains. Now, here, that typical retroorbital or frontal headache of dengue is not prominent. Secondly, these patients will have much more disproportionate joint pains compared to dengue patients. And third, the chances of getting a reddish erythematous rash all over body with flushing of skin are far more with chikungunya compared to dengue. In both these infections, there can be some complications which can involve the liver causing hepatitis like signs and symptoms and abnormalities in blood test. It can involve the kidneys in rare instances where it can lead to acute kidney injury. Occasionally, I mean, that would be even less common than liver and kidney involvement, can be myocarditis, where there can be effect on the heart pumping and heart rate, etc. Occasionally, people may even have dengue or chikungunya related encephalopathy. So, presenting almost like a meningoencephalitis like picture where the patient can be drowsy, have altered sensorium, irrelevant talking, occasionally seizures also. But that is relatively less common infection, less common manifestation. It is perhaps a little more common in children compared to adults. Beyond all this, there are two important complications of dengue which we should be wary of. One is dengue hemorrhagic fever, wherein there are bleeding manifestations and bleeding and coagulation related abnormalities, and the other is dengue shock syndrome. So, are there any clues which can tell us that a particular patient is likely to get one of these complications? The answer is yes. So, what are these clues? First is high grade fever continuing way beyond day 5, day 6 from the onset. Second, bleeding from any mucosal surfaces, so nose, gums, or in the urine and in the stools. Third, postural dizziness. So this typically occurs because of drop in blood pressure, which is of more than 20 compared to sleeping versus standing position. So this is one of the very important and easy to observe symptom as well as sign when it comes to complications of dengue, that if a person is getting up from bed, either sitting or walking to the washroom or within the room, and if the person feels a lot of dizziness, blackout like feeling, or feeling as if he or she is going to fall, then that is a clue that this patient may be having postural hypotension and may be going towards a complication. Fourth is persistent and recurrent vomitings in spite of adequate medical management. Fifth is severe pain, especially on the right side of the abdomen below the ribcage, which could be related to enlargement of the liver. Sixth would be jaundice, which again would indicate involvement of liver and liver function related abnormalities. Seventh is unbearable and very severe headache or abdominal pain, which may indicate internal bleeding. So, if any of these warning signs are present, then such a patient should seek medical attention immediately and has to be admitted for medical supervision. Anyone else who doesn't have these warning signs may not require hospitalization and may not get any complications. Although there should be a close watch for development of any kind of complications, because some of them can be fatal in few cases. So here if we see, there is no mention of platelets in these warning signs. So actually platelet count wise, what count should be considered warning sign is not really important parameter. In fact, reduced fluid content of the blood, which is reflected by a high hematocrit value in our complete blood counts or complete hemogram test, is far more important parameter predicting complications in dengue compared to just a fall in platelets. Because platelets and white cells do fall in each and every patient to a different extent. What is only alarming is if there is a very rapid drop in platelets. Otherwise, what count of platelet is there in a particular patient does not necessarily reflect how mild or severe that person's dengue is. Coming to chikungunya, again, all these systemic complications are far less common compared to dengue, but they are definitely known to occur. Now, needless to say, because both of these are viral infections, no antibiotics are needed and no antibiotics benefit in treatment of either of these two or any other similar viral hemorrhagic fever or arboviral infections like say Zika virus or several others which spread through similar mode of transmission. What is important in these patients is adequate hydration, that is fluid intake, adequate rest, lack of excessive exertion, healthy nutritious food, avoiding anything which is very oily and spicy and which can trigger their hyperacidity and vomiting, and symptomatic treatment in which paracetamol, tepid sponging, this kind of measures should be followed for reducing the temperature even if it is very high, and NSAIDs or painkillers like ibuprofen or diclofenac, aceclofenac, all these things should be avoided in dengue and chikungunya because all these NSAID type of drugs like ibuprofen, aceclofenac, diclofenac, etc., although they are very effective in bringing down the body pain and fever, they also have some impact on the platelet function. They can cause severe gastritis. They can lead to bleeding through any pre-existing gastric ulcers or can cause new erosive gastritis which can eventually lead to bleeding when platelets can drop. So even if the patient has very high fever and severe body pain and headache, these medicines should be avoided when we are dealing with dengue and chikungunya. Now coming to malaria, which is also a mosquito-borne, vector-borne infection. So here what is most important is this should be suspected mainly in areas which are endemic for malaria. So like I said, Mumbai, Chennai, some parts, interior parts of Maharashtra, Karnataka, Andhra Pradesh, etc. And in all other areas where malaria is not so common, then it should be suspected only in patients who have traveled to the endemic areas because the type of mosquitoes which spread dengue, chikungunya and which spread malaria are entirely different. So very often we find that in cities where dengue, chikungunya are more, malaria is relatively common and vice versa. Although both different types of mosquitoes and these different types of infections can coexist in the same city in different areas. What is also important here is that routine use of anti-malarial medicines without confirmation of malaria diagnosis should be strongly discouraged because over last 2 to 3 decades, because of rampant use of anti-malarial medicines for every other fever with chills patient has led to development of resistance to these medicines, because of which many easy to give and orally available anti-malarial medicines are becoming ineffective, like we see with most of the other antibiotics. So how is it diagnosed? So malaria is basically diagnosed through a peripheral blood smear or rapid malaria test, and if both these tests are negative, especially if they are negative when the sample is collected during the peak of fever and chills episode, then anti-malarial should not be given in such a patient. Again, even with malaria, there can be several systemic complications ranging from cerebral malaria where there is involvement of the brain leading to patient getting convulsions or falling unconscious or having altered sensorium and irrelevant talking. It can also cause lung involvement in form of ARDS, which leads to breathing difficulty and at times requires oxygen or even ventilatory support. It can affect the liver leading to jaundice. It can affect the kidneys leading to acute kidney injury and acute worsening of kidney functions. It can even impact the blood cells causing low platelet counts, drop in hemoglobin and drop in WBC, etc. But all these complications are present in different percentage of patients, and overall if we see around 10 to 15% of cases of malaria can have one or more of these complications. Now about dengue, chikungunya and malaria, we shall have separate individual videos to discuss the finer intricacies related to their clinical features, diagnosis and certain other myths and facts related to each of these infections. As far as this video is concerned, going to the next type, that is the rickettsial fever. Now this is one thing which I would like to highlight a lot in this video because it is extremely common and extremely important infection when it comes to rural parts of our country in most of the states, when it comes to outskirts of the cities or urban areas. So typically the places which are the famous tourist spots, picnic spots or monsoon trek related spots where there is a lot of plantation, lot of height of grass or a lot of trees, and where there can be a contact with animals more often than urban areas. And this is also important for people who have various pets at their homes. Okay, so this group of infection basically spreads through insects like ticks, mites, etc. Now these insects, the difference in their bite versus the bites by mosquitoes, ants or other insects is that these bites usually go unnoticed because they do not cause itching, pain, such sensations, and it may not always give rise to any rash. So many a times we don't realize that we have been bitten by one of these insects, and 5 to 7 days later the disease typically starts with symptoms like severe muscle pains. So there is a lot of pain in all the muscles like arms, thighs, calves, lower back, followed by joint pains and then followed by high grade fever with chills. Now these infections typically continue till the patient is diagnosed and treated, and in this case because it is a atypical bacterial infection, antibiotic is necessary to cure this infection. But like I said, because it's atypical bacterial infection, most of the common antibiotic groups do not work on this type of infection. What works is typically an antibiotic called as doxycycline and the alternative being azithromycin. So only when this antibiotic is given, then the fever subsides in around 48 to 72 hours. In fact, this thing is such an important feature of rickettsial fevers that it is often said in medical field that if a fever of more than 5 to 7 days duration which was not responding to prior treatment responds to doxycycline in 2 to 3 days time, then it is almost confirmatory that it is likely to be one of the rickettsial infections. Of course, there are tests like rickettsial PCR and others for diagnosis of these infections. Even in rickettsial fevers, there can be various systemic complications which present in different types of patients, ranging from hepatitis, acute kidney injury, low platelet count, high WBC count, lung involvement leading to ARDS, and occasional cases of meningoencephalitis because of effect on the brain. Again, the treatment is doxycycline, where 7 to 10 days course of this antibiotic can cure the infection. Why this is to be stressed is because in comparison to most of the other vector-borne infections like dengue, chikungunya or other viruses, this particular infection requires antibiotic like doxycycline. So we should be able to suspect it in the correct patient so that this antibiotic can be given and the patient can be cured. Now, as a collective, for all these vector-borne infections, there are some common prevention measures like most other infections. And for a change, hand hygiene is not one of them when it comes to vector-borne infections. First and foremost is avoiding accumulation of water at different places around our house and working places. So it could be anything ranging from the flower pots, the plant pots in our balconies, various discarded coconut shells or discarded tires or small pits on the road where this water can accumulate, and over next week or two these mosquitoes which can spread dengue and chikungunya can grow over such collections. So in less than 5 to 7 days from collection, such water should be cleaned. Before monsoon peaks and before dengue and chikungunya cases peak, necessary spraying of insecticides should be done in all such areas which could be potential breeding sites for these mosquitoes. Again, these mosquitoes mainly bite humans during dusk and dawn. So typically the times when or relatively elderly people go for their morning walks, or the younger kids go in the evenings to their parks and gardens for playing. So during these two times of the day especially, we should wear as much as possible full sleeves shirts and full sleeves trousers. We can use insect repellents either directly over clothes, or some of which are safe over skin, then directly over skin. Within the house we can make use of mosquito nets and insect repellents within the house also. But always remember, the mosquitoes which spread dengue and chikungunya, they mainly bite during daytime or dusk and dawn time, not necessarily during the night. So even if we are taking all the precautions at night but do not take adequate precautions during the day, still these infections can catch us. Secondly, when it comes to insects like ticks, mites, so whenever somebody has gone to any forest areas or any mountains for treks or any such habitats where there is a lot of plantation or high grass or contact with animals, we should always check immediately after returning from such a place, or even farmers immediately when they come back from their farms, they should check areas typically behind the ears, around the waist area, in the armpits or axilla, and over the feet near the ankles. So where typically these insects can stick to our skin or can bite to us. If you find any ticks attached in such areas, they should be gently pulled upwards and removed without pulling them laterally or twisting them, which can break parts of the tick and let it be inside the skin itself. Also, whenever we go for any outdoor picnics or treks, when we put our clothes for drying, typically these insects hide near the stitches of our clothes. So such clothes, before we use them, should be properly dusted, cleaned and washed, and checked if there are any ticks hiding at such places, and which can later on bite us at these relatively hidden or covered areas. Even for ticks and mites, insect repellents, full sleeves clothes definitely help. If you are going to a forest area or densely plantation like area or area where there is tall grass, try to tuck in your trousers within the socks and shoes so that the insects can't enter from that gap as well. And wherever possible, try to cut the grass to shorter levels so that the insects are not able to reach our body parts behind the ears and shoulder, waist, etc. In addition to this, awareness about all these infections and awareness towards treating the patients earlier, rapidly with appropriate treatment is extremely important. So that also helps in preventing this infection. So friends, if you found this today's video informative, please like, share and subscribe to the channel of Fever Care Center for Infectious Diseases. Please don't forget to mention in comment box your suggestions for improvement in our videos and for future topics to be discussed on this channel. Because remember, stay informed to stay healthy.